Alexandra, Saieh is from Save the Children. Alexandra, thank you for joining me. Gaza's health ministry has reported now more than 120 famine-related deaths, including dozens of children. Is this what your staff are telling you?
What our staff are telling us is that the situation is worse today than it ever has been. And, we operate a health clinic in central Gaza where we actually treat children and mothers for malnutrition. And what our colleagues are saying is that there's been a noticeable spike in cases of malnutrition amongst children and mothers in the last few weeks. So what our staff are saying is that the situation is getting worse. It's deteriorating very quickly. Our own staff are coming to work hungry, tired, and exhausted because they're not getting enough to eat. And, in terms of the children, we know that they are the ones who suffer the most and suffer first. We've been seeing malnutrition amongst children across the last 21 months, but in the last few weeks and months, we have seen this significantly worse. And there's almost no aid entering Gaza right now. The aid that is entering through the food distributions, through the Israeli government-backed Gaza Humanitarian Foundation, is not reaching the people most in need. We've seen these food distribution sites basically become races where it's survival of the fittest, racing to get food, and that's not how you deliver humanitarian assistance. Palestinians in Gaza today are being faced with the impossible choice of facing gunfire just to feed their families or starving. And that's just absolutely unacceptable. And unfortunately, with these, we know that at least 80 children have died of malnutrition. And the at least four of those deaths took place in a single day. So that's an indication this week that deaths as a result of malnutrition, as a result of starvation and dehydration and disease are now accelerating, and we may be beyond the tipping point.
If international aid doesn't come quickly, what do you think the next month will look like for Gaza's most vulnerable, especially the children and the elderly?
It is going to look very bleak, very dire, and I'm afraid that in many cases it may be too late already. When malnutrition affects children under 5, they may have stunted growth. It will impact them in terms of their cognitive and physical development. What they're experiencing now will have lifelong consequences for them and for their future survival. So for many children, it's too late. But we need to get aid in as soon as possible. And not just that, we need full humanitarian access. We need to lift the siege. We need the Israeli government to completely lift the siege on Gaza. And we need the international community to put the pressure needed to make that happen. We also need a ceasefire because there is no safety in Gaza for anyone, not civilians, not aid workers. We can't do our jobs in Gaza as bombs rain down across the entire enclave. We've had to suspend services this week because it's become so unsafe. There have been new displacement orders issued. All of these factors contribute to the catastrophe that we're seeing now, which is starvation, mass starvation spreading across Gaza.
Alexandra, Saieh from Save the Children, thank you very much indeed for that.
Thank you for having me.